Hello, my name is Dr. Diwan S. Raja. Today I will discuss about the joints of the thoracic wall. We have multiple bones. In the thoracic wall, we have 12 pairs of ribs, 1 sternum, and 12 thoracic vertebrae. So we'll start one by one with the joints. First of all, we'll go to the anterior thoracic wall. We have the sternum here. This is the sternum. This is the sternum. And sternum has 3 parts. One is the manubrium sterni. This is the manubrium. This is the body of the sternum. And this is the xiphoid process. So joint between the manubrium and the body of the sternum is the manubriosternal joint. Okay, we'll go through that joint. So joint name is the manubriosternal joint. Manubriosternal joint. What type of joint is this? This is a secondary cartilaginous joint. Secondary cartilaginous joint. Cartilaginous joint. What are the articulating components? Articulating components are the manubrium and the body of the sternum. Okay, we got that. And it is a secondary cartilaginous joint. It is a symphysis. It is in the midline of our body. Symphysis, and between the articulating surfaces we have fibrocartilage. Okay, the articulating surfaces are covered by the hyaline cartilage, and in between the articulating surfaces we have the fibrocartilage. A fibrocartilage plate. Fibrocartilage plate is present in between the manubrium and the body of the sternum. Okay. So is there any movement here? We have very minimum movement. Anterior-posterior movement is possible. Okay, minimum movement. There is mostly anterior posterior movement, and this joint should have fibrocartilage plate in between them, but around 10 to 14% cases there may be synostosis. 10 to 14% cases. Okay, in the later life there are synostosis. Synostosis, that means union of two bony parts by osseous element. Bone will continue from manubrium to the body of the sternum. Okay, so it is the osseous communication between two components of the bone, that is synostosis, that may happen in 10 to 14% cases. Movement is very minimum, anterior posterior movement. Okay, so we got the manubriosternal joint. Now we go to the Xiphisternal joint. Xiphisternal joint, that is the joint between the xiphoid process and the body of the sternum. This is the Xiphisternal joint. Okay, this is the joint, Xiphisternal joint. Okay, we'll go there. Articulating surfaces are the body of the sternum and the xiphoid process. Okay, what type of joint is this? This is an example of primary cartilaginous joint. Primary cartilaginous joint. So you can call it synchondrosis. Synchondrosis. Here bone union is taking place in the early life, that is the synchondrosis. Okay. Movement is because it is primary cartilaginous joint, movement is very minimum, almost no movement. Okay, we got the Xiphisternal joint. So we got the Manubriosternal joint, secondary cartilaginous joint, Xiphisternal joint, primary cartilaginous joint. Then we'll get joint between the costal cartilage of the rib and the sternum. We have the first sternocostal joint here is the first costal cartilage. Then we'll get the first rib. Then the second sternocostal joint here, third sternocostal joint here, fourth sternocostal joint here. So the sternocostal joint. Okay. Now we'll go to the sternocostal joint. Sternocostal joints. First sternocostal joint. First sternocostal joint. This joint is the joint. This is a primary cartilaginous joint or synchondrosis. To remember that this is primary cartilaginous joint. Okay, and this is a synchondrosis. Okay, so this is the primary cartilaginous joint. How about the second, third, fourth, fifth sternocostal joints? Fifth, sixth, seventh sternocostal joints. Sternocostal joints. These are plain synovial joint. So this is a plain synovial joint. Okay. So this will actually fix the rib, first rib with that of the sternum. So here movement is minimum. Here we'll get movement here. Plain synovial joint. We have sliding and gliding movement here. Plain synovial joint. So it is synovial joint. So it should have synovial cavity. It should have synovial membrane. It should contain synovial fluid. Okay. So that is the these are the sternocostal joints. Is there a ligament there? Yes, we have the anterior and posterior radiate sternocostal ligament. We have the anterior and posterior radiate sternocostal ligament. Radiate, anterior and posterior radiate sternocostal ligaments. Okay, we got the ligaments, sternocostal joint. These are the plain synovial joint. The second, third, fourth, fifth, sixth, seventh sternocostal joint. This is the joint between the costal cartilage and the lateral border of the sternum. Okay, so second, third, fourth, fifth, sixth, seventh. So they will be connected to the lateral part of the sternum, and that joint is those joint are the plain synovial joint. We got that. Now we'll find out that this is our sternum costal cartilage, and our sternum is also connected to that of the bone. This is the clavicle. It is connected to the clavicle here. We have a clavicular notch here on the Manubriosternal. Okay, so these are the connection of the clavicle to the upper border of the Manubriosternal, just lateral to the jugular notch. This is the jugular notch or suprasternal notch. So here head of the clavicle will be articulated. We can say the sternal end of the clavicle. It's better to say sternal end of the clavicle is articulated to that of the sternum. So what type of joint is that? That is the sternoclavicular joint. That is the sternoclavicular joint. Okay, so we go to the sternoclavicular joint. Okay, what type of joint is that? Sternoclavicular joint is a synovial joint or saddle type of synovial joint. It is a saddle or saddle. Okay, saddle type of synovial joint. Synovial joint. Okay, this is cellar type or saddle type of synovial joint. Okay, this is the sternoclavicular joint. Okay, so it is synovial joint. So certainly it should have movement, and that movement is related to that of the shoulder girdle. So we should have flexion, extension, rotation, protraction, retraction. So depending on the axis of the joint, we have multiple movement is possible here in the saddle type of synovial joint. Okay, we got that. What are the ligaments here? We have multiple ligament. We have the anterior and posterior sternoclavicular ligament, anterior and posterior sternoclavicular ligament, sternoclavicular ligament. We have also interclavicular ligaments. We have interclavicular ligament. So we have the ligaments there. Okay, this joint is divided into two compartments by an articular disc. You have to remember that this joint, the sternoclavicular joint, is divided into two by an articular disc. Okay, articular disc. So this joint is divided into two compartments by an articular disc. Into two compartments. By an articular disc. So we have multiple movement. So we have done the joints of the anterior thoracic wall. Okay, now we'll go back. Joint between the vertebra. Here we have the thoracic vertebra. We should have 12 thoracic vertebra. So joint between the body of the vertebra. This is the body of the vertebra, another body of the vertebra, the intervertebral disc in between them, and this joint is the intervertebral joint between two vertebral body. Okay, so intervertebral joint. Intervertebral joint. What type of joint is this? This is an example of secondary cartilaginous joint. This is a symphysis. That is secondary cartilaginous joint. Secondary cartilaginous joint. Okay, this is an example of secondary cartilaginous joint. Okay, we got that. So what are the ligaments? We have multiple ligaments, anterior and posterior longitudinal ligaments, anterior and posterior longitudinal ligament. Okay, we got that. And we have also other ligaments along with the vertebra, like supraspinous ligament, interspinous ligament, supraspinous ligament, and also ligamentum flavum. Okay, that is connected to that of the lamina of the vertebra. So these two, anterior and posterior longitudinal ligament. Plus, if you think about the vertebra, then we have also supraspinous ligament, interspinous ligament, and ligamentum flavum. Movement, we have actually between two bone, movement is minimum. When we combine all the bone together, then we have plenty of movement, like flexion, extension, lateral rotation. Okay, so we have flexion, extension, lateral flexion and rotation, lateral flexion and rotation. Okay, we have multiple movement. Okay, so we got that, the intervertebral joint. How about this? This is the intervertebral disc. It's very important. Intervertebral disc. What is the function of intervertebral disc? Okay, intervertebral disc. That is important to us. Intervertebral disc. Okay, so we have the intervertebral disc like that. Okay, we have annulus fibrosus, and we have nucleus pulposus. This structure in adult is a fibrocartilage. So this is fibrocartilage. Okay, it contains a lot of collagen fibers. The nucleus pulposus is this. Nucleus pulposus. This develops from notochord, and it contains some of the cells, round cells from notochord that may disappear after the age of 20. It is gelatinous. Okay, it is mostly for shock absorbing purpose. Okay, you must remember this intervertebral disc. It provides 1/4 length of the vertebral column. Okay, got that. Okay. So we have the annulus fibrosus here, the periphery. This fibrocartilage, annulus fibrosus. Okay, we got that. Main purpose of the intervertebral disc, that is shock absorber, okay, prevent bony erosion between two vertebrae, erosion, and resist tensile force, So these are the functions of the intervertebral disc. We got that? Okay. So we got this. Now we'll go to the other joints. Okay. Between the vertebra, we got that. This is the intervertebral disc. Here is the intervertebral disc. Here, this is the intervertebral disc. We have also joint between the articular processes here. One articular process is here, another one is here. They will be they will make a joint. Okay, we can try that. Okay, this is the zygapophyseal joint. Here is the zygapophyseal joint between the articular processes. This is a joint of the vertebral arches. Okay. Joint between the vertebral arches, okay, that is between the articular processes, okay. It is also called facet joint, also called facet joint, facet joint, okay, also called facet joint. Okay, what type of joint is this? These are the plain synovial joint. Okay, joint in the thorax and cervix are simple. As it goes down, it will be little bit complex. Okay, and movement is more in the cervical region. Will not go there, rather than that of the thoracic region. Okay, so it is plain synovial joint. Okay, we got the joint between the vertebral body, joint between the articular processes. Okay. Now we'll go to the joint between the rib and the vertebral body. Okay. On the vertebral body, we have the costal facet. Okay. Superior costal facet, inferior costal facet. Superior costal facet, inferior costal facet. So you have to know that part. Joint between the vertebra and the head of the rib. Okay. Joint between the costal facets and the head of the rib. This is one type of joint. Another joint is the joints between the transverse process of the vertebra and the tubercle of the ribs. Okay, we'll go one by one. Okay. First of all, the costovertebral joints of the head of the rib, and the costotransverse joint. These are the costovertebral joints These are the costotransverse joints. Okay, to know that part. So costotransverse and the costovertebral joints had how that work. So each rib head has two articular processes. Okay, we have the rib articular processes. The lower part will articulate with the costal facet of the corresponding vertebra. Upper part will articulate with the costal facet of the superior vertebra. So head of each rib with superior demifacet of corresponding vertebral body and inferior costal facet of the vertebra superior to it. Okay, we got that. So we got that the articulation with the head to that of the costal facet. This part of the head articulate with the corresponding with the costal facet, the superior costal facet of the corresponding vertebra, and this part will articulate with the inferior costal facet of the one vertebra above. Okay, so we have to know that head of the 10th, 11th and 12th rib articulate with the corresponding vertebral body only. Okay, so that does not articulate with one vertebra above in case of 10th, 11th and 12th ribs. The tubercle of the rib. Okay, so if we go to the tubercle of the rib, it will articulate with that of the transverse process of the corresponding vertebra. This is the tubercle of the rib. So we got tubercle. Tubercle will articulate with the corresponding vertebra. So we got that. This is the tubercle of the rib, articulates with the transverse process of the corresponding vertebra. This is the way for in case of the typical ribs. Okay, so this is the head of the rib. This is the head, and this is the lower articular facet. This part will articulate with that of the superior costal facet of the corresponding vertebra. This part will articulate with the inferior costal facet of one vertebra above, and this part will articulate with the intervertebral disc with a ligament, intra-articular ligament. Okay, we have also connection with that of the radiate ligament, intra-articular ligament. Okay, we have here we get also radiate ligament and intra-articular ligament. Okay, we got that. Then we have to remember that we have also joint between the interchondral joint between the costal cartilages. These are plain synovial joint. These are also plain synovial joint here. Plain synovial joint. We have interchondral joint between the 5th, 6th, 7th, 8th and the 9th costal cartilages. These are the hyaline cartilages. Interchondral, they are also connected by interchondral ligaments. And articulation of the 9th and 10th costal cartilage is fibrous. And we have articulation between the costal cartilages. These are plain synovial joint, interchondral joints. joint between the ribs, between the costal cartilages, are the plain synovial joint. Okay. Now we'll get some of the clinical anatomy. Okay. Clinical anatomy is important to us. Clinical anatomy. Okay. So we may have herniation of the intervertebral disc, the nucleus pulposus, posterolaterally. Okay, that may compromise the spinal nerve, that may lead to sciatic pain or maybe back pain here in the or thoracic region. So there may be herniation of the nucleus pulposus posterolaterally through the annulus fibrosus. So herniated disc. That is the herniation of the nucleus pulposus posterolaterally through the annulus fibrosus. Okay, that condition is called herniated disc, annulus fibrosis. That may compress the spinal nerve. Is one problem. We may have another problem. Our joint may undergo, especially the costotransverse, especially the facet joint, or we can call it zygapophyseal joint between the articular processes of the vertebra. Zygapophyseal joint. Okay. Facet joint, zygapophyseal joint may undergo osteoarthritis. Okay, so these are the common clinical anatomy: herniated disc and osteoarthritis. Okay, so that's all about the joints of the thoracic wall. If you like my video, please support my channel, please subscribe me and share the information with your friends. Have a nice day. Bye now.